Hi, everybody. Today we are going to be focusing in detail on the axillary breast. You might think that it's a rare topic, but it's a very common problem which our patients come to us with. And I'm so happy that I could be discussing in detail about this problem which our patients may have. Now, what is this axillary breast? First of all, you should understand that this problem is present in women, and you'll be surprised that 6% of the population have the axillary breast. Now, when it comes to the causes of the axillary breast, you can actually take it back to the embryology or when we were in the fetus stage. And if I have to explain this in more detail, there is something called as the milk line between the axilla and the groin. Now, what happens is during the development of the fetus, only that part which is supposed to form the future breast remains, and the rest of the part of the milk line disintegrates. So, when a girl is actually developing, going through the puberty, and when she's developing, the breast gland forms and the other parts are actually non existent. But in 6% of the population, parts of this ridge remains, and this presents as accessory breast. And because one of the commonest location, two-thirds of the axillary breast present in the axilla, so it's called the axillary breast. How do our patients present with the axillary breast? Most of the concerns are primarily cosmetic. Now, a lot of our women folk will want to wear sleeveless tops, and they'll want to look better. But for me, it's not just about the looks, it's also about the discomfort that this particular prominent axillary breast causes. So there could be pain, there could be pain, there could be discomfort. And usually the pain and the discomfort is more prominent during the menstrual periods. So that is when they experience a lot of discomfort, and also because of the location, because of that being located in the armpits, there can be excessive sweating. And because of this pain, they're constantly keeping their arms slightly away from the body, and this is very discomforting. They get fatigued, and it could be pretty discomforting for these patients. So, cosmetic concerns, one issue, and also the other functional aspects like pain, discomfort, sweating. So, this is why patients approach us. Now, sometimes they also approach us because of diagnostic concerns. So you must be aware that any lump in the armpit is just not cosmetic. We also have to rule out the other causes. It could be a prominent sweat gland. It could be a prominent sebaceous cyst. It could be associated with malformations arising out of blood vessels. It could be a lymph node. So there's so many other problems which have to be ruled out. So it is better that you get examined by your physician, by your surgeon, and we run a few tests. The basic investigation that we actually run on you is an ultrasound scan, which gives us an idea as to what the nature of this swelling is. So let's say if it is just cosmetically disfiguring, we run an ultrasound scan, we rule out what is the composition of this particular swelling. Whether it is only fat, whether it is fat plus breast tissue, whether it's a combination of the two. So we get an idea. Based on the composition, we can actually guide you to treatments. You have different grades of the axillary breasts. Now, when we talk about the milder grades, they are just about cosmetically not pleasing, but that's about it. There's no pain, there's no other problem. So these are the kind of swellings, they could be left alone. The patient is not bothered about the looks, not bothered about the other problems. You could leave this patient alone and they could lead their normal lives. But when there is a higher grade of the swelling, that's when it becomes a problem. It becomes noticeable, it becomes more and more painful, it becomes more and more disfiguring. So higher grades of swelling associated with more cosmetically disfiguring looks is when we have to intervene as plastic surgeons. As a plastic surgeon, our goal is to address the concerns of the prominent axillary breast, and at the same time cause least amount of scarring. So in my practice, I deal with these problems. I remove the excess fat. I remove the excess breast tissue with the least amount of scarring, and we'll talk about the treatments which we'll be discussing in detail for this particular problem. So, what was the treatment for the axillary breast? Let's say a couple of decades ago, or even 10 years ago. Any surgeon would actually remove this particular swelling, but that would amount to extensive scarring or even prominent scars in the axilla, which may not really be pleasing. Now, as a plastic surgeon, what we do is we do a short scar reduction of the axillary swelling, where the scar is actually hidden in the armpit. What we first do is we do a liposuction, get rid of the excess fat. Now, when we do a liposuction, the swelling is actually shrinking. I'm talking about the situation on the operation table. So we do the liposuction, the swelling is kind of reduced. After removing the fat, there is still component which is called the breast tissue. So no matter how much of radiofrequency energy we may give in these severe cases, the skin contraction is not going to happen. So in these cases, what we do is an axillary tuck, meaning just like tummy tucks, we remove the excess skin. Again, through a very hidden incision. You're not going to see the incision or the scar prominently. Through this incision, we remove excess axillary skin, and we again contour the axilla, and the recovery is in a period of 1 to 2 weeks. The surgery as such is safe. It's performed under general anesthesia, and usually we do this for both sides. One may be more than the other side. Very rarely is it only unilateral or single sided. And it's done under general anesthesia. It's a safe surgery. The surgery is done in 1 to 2 hours of time. It can be done as a daycare procedure, meaning the patient can be discharged on the same day, and frequent follow-up visits are required for change of dressings, and usually the healing is complete by 1 week or 10 days. Following healing, the patient may have to use massages to get rid of the swelling and to shape up the axilla, armpit, and see the desired result. There are very few conditions which will require the plastic surgeon's help, and this is one such condition. Why we say that you need the surgeon's help is because this is breast tissue. Now, breast tissue is not going to shrink with the diet, it's not going to shrink with exercises. So, no matter what exercises or dieting you may choose, this tissue is likely to persist. So, this is the reason why we suggest our patients that you undergo corrective surgery for this, and so that it is cosmetically very pleasing, and you can actually get rid of the pain if it is associated with this swelling, and you'll lead a normal life. So, how does one prepare for the axillary breast surgery? Standard, just like any other surgery, a list of blood tests will be given to you. You'll have to get the blood tests done. This ascertains your fitness for anesthesia. The important thing is you must get an ultrasound. Now, the ultrasound will help the surgeon, plastic surgeons, to determine how much of the swelling is actually fat and how much is the this. So this will give an idea for the surgeon to say that, okay, I need to be doing a little bit of liposuction before removing the gland, and then the surgeon will remove the gland, and if there's excess skin, he will probably use a concealing incision to lift the skin and also to tuck the skin. To actually summarize today's discussion, this is nothing to be worried about, but having discovered this particular swelling, it's important that you get an ultrasound so that all the other conditions could be ruled out. There's no fear of cancers, no fear of lymph nodes. There's no other condition which needs to be addressed. It's purely cosmetic. It is safe surgery, and within a period of 7 to 10 days, you would probably heal. And You can get back to your daily routines. And if you're very used to wearing the sleeveless, it gives you that confidence back. The reason why this particular podcast is being discussed is because 6% of our population actually have this problem. They're silently suffering, and you need not suffer in silence. How do you know that this particular lump or the bag in the axilla is not cancerous? A very important question, because we need to know this and we need to address it initially. So, whenever there's a patient who comes to us and we suspect that this is not because of just fat and breast tissue, we get an ultrasound scan done. Now, it's important that we rule out enlargements of the lymph nodes, which can happen in cancer afflictions of the breast. So, it could be a reactive lymph node, it could be a significant lymph node. And now, if the ultrasound reveals that this swelling is a lymph node, then the next diagnostic would be a needle aspiration cytology. So a needle is put, fluid is aspirated from the lymph node, and then you get the definitive diagnosis. So if it's a lymph node, yes, the route is different. It goes to a cancer surgeon, and then the cancer surgeon deals with according to the protocols. But we are discussing this from the point of view of pure cosmetology, pure aesthetics. So 99% of the times, this is just fat and breast tissue. And if the other conditions are ruled out, safely these procedures can be carried out without even worrying about cancer and other conditions.